Hello, dear viewers, and welcome to the new episode of Medical Talk, your trusted destination for reliable medical knowledge and expert insights. Our health is our greatest asset, and understanding common medical conditions can help us prevent complications and seek care at the right time. One of the frequently overlooked conditions is hernia, a problem that affects many adults but is often misunderstood or ignored. A hernia may begin as a mild discomfort, but without proper attention, it can lead to serious complications. To help us explore this important topic, we are pleased to welcome Dr. Shamlan Alqinai, Senior Specialist in Upper GI and Acute Care Surgery. Stay with us. I'm Abdullah Al-Ajmi, and you're watching Medical Talk. Dear viewers, we have the honor of welcoming Dr. Shamlan Alqinai, Senior Specialist, Upper GI and Acute Care Surgeon. Welcome with us, Dr. Shamlan. It's an honor to have you with us on Medical Talk in this episode.
Thank you. The honor is mine. Thank you for having me.
So our topic today is hernia.
Yeah.
For the first question, what exactly is hernia and what causes it? Is it a genetic? Is it lifestyle?
So hernias, they're a very common condition. We see it, it's probably one of the top 5 cases that we do in general surgery or acute care surgery. Hernias are usually a weakness in the tummy wall. And because of this weakness that kind of grows over time and an increase in pressure inside the tummy, you end up having either a piece of an organ or the internal tissues herniated and trapped, and usually the patient presents with a little lump. So they're very common, especially with the varying age groups, and we see it as probably one of the top 5 conditions that we treat here in the hospital.
Dr. Shamlan, what the main causes of hernia in adults or otherwise?
So usually it's a pre-existing weakness in the abdominal wall. This is combined with an increase in intra-abdominal pressure, so basically the pressure inside your tummy. Some risk factors exist with some patients. For example, patients that have a chronic cough, that are especially if they are smokers, if they're obese, so in a higher BMI, if they had previous surgeries. So there's and diabetics. So you have various risk factors that increase the chance of developing a hernia, and it usually develops over time.
What the symptoms exactly? What the first thing that people usually notice, or they keep lookout for, so they can avoid, or maybe the first things they notice?
So the most common complaint that a patient presents to our clinic, he feels that there's a swelling or a lump. There are specific areas in the tummy that this lump may exist. The other more common way of presenting is pain. So a patient may have a pain in a specific area of the tummy, and this prompts us to do a physical examination. Sometimes from a simple physical examination, we can easily tell that the patient has a hernia. And then we usually follow up our evaluation with imaging, so either an ultrasound or a CT scan, and in some cases an MRI. And then we kind of have a better idea of the anatomy of the abdominal wall. And then we can take a decision together with the patient.
Dr. Shamlan, when exactly should someone seek a medical advice? At what stage exactly? Or what the first symptoms they notice, so that they actually can seek the medical advice?
So that's a good question. Most of the emergency cases that we operate on in the hospital here is because a patient knows he has a hernia, did not treat the hernia, and in a day or 2 days the hernia becomes painful, becomes incarcerated. So the word incarcerated means trapped. So the hernia basically goes through the abdominal wall and gets trapped and doesn't go back. So if the patient knows that they have a hernia, it's important that they seek medical advice. If the hernia becomes painful, or the patient has a change in the bowel habits or a change in the overlying skin, then it's probably a good idea to seek medical attention immediately. But if I was going to give a piece of advice to anybody that does have a hernia, don't leave it for years, assuming that it may not change in character. It's very important that you see a specialist and get your hernia treated if it permits so.
So, Dr. Shamlan, many people delay treatment. Is there any warning signs that people can notice so they can check early on any hernia?
Yes, absolutely. If you have a pre-existing hernia and you know you have a hernia, if the hernia changes in character, so for example, becomes more painful, becomes trapped, meaning that yesterday you had a lump that can easily be reduced or goes back inside, and all of a sudden this lump cannot go back inside, or it's trapped. If you have a change in your bowel habit, so you have an inability to go to the bathroom, if your tummy is distended, or you're feeling bloated and this is unusual to you, if you see the skin around the hernia site changing in color, then you definitely need to seek medical advice as soon as you can.
Yes, Dr. Shamlan, you said the hernia is trapped. So is there like stages? Is it?
Yes, there is.
Can you explain what stages
So
are?
there's just two stages. So it's either incarcerated or strangulated. So incarcerated, the word means trapped. So it's basically trapped and you're not able to manually push it inside. Strangulation is when there's a compromise in the blood supply. So these are usually emergent surgeries, and most of these patients have these hernias for years, and the change in character happens over days. So you can imagine how serious it is to get medical attention and make sure that you have make sure that you have a follow-up consistently with a surgeon that is able to do hernias.
Well, Dr. Shamlan, that was clear. Thank you for answering this question. We definitely have more questions coming up after this short break. So welcome back, dear viewers. We're still with Dr. Shamlan, continuing with our topic for today, which is hernia. So, Dr. Shamlan, how are hernia diagnosed in clinical practice?
So most of these patients end up in our clinics. We do a detailed history, a detailed physical exam, and usually on physical exam, you can pick up if this patient has a hernia. Some hernias exist in a subset of patients that don't have symptoms and are discovered for other reasons. Having said that, there are ways to complement your physical exam. So we usually order an ultrasound or a CT scan, or depending on the situation, an MRI, which gives you a detailed idea of the abdominal wall, and then you can make a decision with the patient together.
So, Dr. Shamlan, is there any other way to treat hernia without surgery? Is there like any other minimal non-surgical options maybe patients can choose?
So to fix a hernia, as of today, there's no other way except surgery. Having said that, there are data on different types of hernias that you can watch and wait, especially if the patient is not fit enough to undergo surgery. But usually we treat them surgically, and that's the only way to get rid of hernias, especially as of today.
How would you check if the person is ready to go to surgery, or they can maybe do another route so they can get ready to the surgery?
So usually to know if the patient's high, moderate, or low risk for surgery, we send them to the anesthesia service, and they evaluate the patient and decide. So if they tell us that we are able to operate on these patients without an increased risk to their health, then we go ahead and we proceed with operating on these patients. And there's multiple approaches when we choose the type of surgery.
What I understood is hernia is connected directly to the abdominal wall. Does maybe if a fit person who works out a lot is more safe from hernia, or does this connect?
So there's no direct correlation between weightlifting and hernia development. But if the patient has a pre-existing weakness, and does heavy lifting in the gym or specific high-risk maneuvers, they can eventually develop a hernia. But there are been studies that suggest that if you increase core health and you improve core health, that protects you in the long run of developing some types of hernias, not all of them.
So not all types of hernia are person is not protected from all types if you work out or maybe keeping up with their fitness routines. So he's not 100%.
No, that's very hard to study without. It's hard to study this over time. So regardless, a healthy core does protect you against a specific types of hernias, but definitely doesn't protect you 100%.
So Dr. Shamlan, what are the latest techniques used to deal with the hernia?
So over the last 20 years, we started developing more minimally invasive techniques. So we do laparoscopic surgery, which basically means that you make small incisions in the tummy. This adds up to less pain, quicker recovery. But you have to understand that it's very hard for me to generalize that technique over every patient. So it's very important in hernia surgery to choose the right surgery for the right patient, meaning that you have laparoscopic approaches, you have robotic. So in this hospital, we do a lot of robotic surgery, and then you have open surgery. So open surgery does not mean that it's old-fashioned. Some patients still require open surgery, and some hernias are simple and some are complex.
So it depends on the case itself?
Absolutely, yeah. 100%.
So some cases need to use the latest equipment. Some maybe they just need the old traditional way, which is depending on the case.
100%. So you have a very specific entity of hernias called complex hernias. So complex hernias are basically large hernias or recurrent hernias. That means the patient had a previous repair, or based on their location, and as I mentioned, based on their size and based on the general condition of the patient. These patients usually end up with open approaches, and again, does not mean that you are trying to avoid using later technology. It's just usually the safest option for these patients.
So some cases are reoccurring. So they already treated the hernia, but it reappears again.
Yeah.
So that takes me to my next question. How does recovery, how important is recovery after the treatment, after the surgery?
It's probably the most important part of the surgery. So it's very important that we realize that the abdominal wall is one of the largest muscles, or the core is one of the largest muscles in the human body. It's responsible for many things that we take for granted. Getting up from this chair requires your core.
True.
Going to the restroom requires your core. So it's very important that when we operate on a patient, our job as surgeons is not done. So we need to make sure that we have close follow-ups to make sure they don't develop specific complications or chronic pain. But it's also important for us to make sure they return to their normal function. So my patients, for example, I written a 6-week program that they have to go through this program to make sure that they are back to normal life, if anything better, in a more better state. So it's recovery is probably the most important aspect of hernia surgery.
So the routine that the people do after surgery, does it is it like a type of maybe recovery workouts or maybe diet?
Yeah, the recovery workouts control your weight. The recovery workouts include breathing exercises. Usually you graduate into isometric holds, and then slowly you go back into some sort of strength training, because long-term strength training does help build the core. It's just you have to understand that you cannot adopt these techniques very early in the recovery period, just not to increase the risk of complications very early on.
Well, Dr. Shamlan, thank you for answering these questions so far. We still have more questions for you after this short break. Welcome back, dear viewers. We're still with Dr. Shamlan talking about hernia. Dr. Shamlan, let's get right into it. Is there like a certain group of people who are at higher risk of getting the hernia disease?
Yeah, so it's there's three major groups. So patients who have a high BMI, so obese patients, patients who are smokers, and poorly controlled diabetics. Those are three risk factors that patients that have hernias should control these factors before considering surgery. Now, in general, risk factors, they may allow patients to be prone to developing hernias. So obese patients, previous surgeries, chronic cough, increase in abdominal pressure, high-risk maneuvers, and a pre-existing connective tissue disease or pre-existing weakness in the abdominal wall, all predispose these patients to eventually developing hernias.
So you mentioned smoking and diabetes, and you also mentioned BMI. Can you tell us what's that?
Yeah, so the body mass index is basically, it tells you, it gives you a good idea of this patient's, whether they're overweight, whether they're obese, whether they're super obese. That gives you an idea of their overall body mass index.
So Dr. Shamlan, you mentioned chronic coughing. How does that affect hernia?
So chronic coughing increases intra-abdominal pressure. So if you have a weak point in the abdominal wall, usually if you have an internal organ or some tissue, it may herniate through this defect.
Dr. Shamlan, let's say someone already underwent hernia surgery. Is there any way to prevent hernia from coming back after the surgery?
Absolutely. So controlling your weight, exercising, the ability to stop smoking, and controlling your blood sugar, especially if you're diabetic. These help reduce the risk factors of developing complications in the early post-operative period and over the long term. Absolutely.
Dr. Shamlan, what lifestyle changes can a person do to prevent or reduce the risk of getting hernia?
So anything that reduces or increases the intra-abdominal pressure may predispose this patient. So, for example, control the patient's cough. Make sure if you're smoking, you stop smoking, or you try your best to cut down on smoking until you're completely off it. If you have an increased BMI, make sure that you try your best to reduce that BMI. And if you are working out in the gym, make sure that you have proper technique and you avoid high-risk maneuvers, especially if you have a pre-existing hernia, or if you had a pre-existing surgery. You have to be very careful at returning to working out and exercising, and gradually develop your strength over time.
Well, Dr. Shamlan Alqinai, thank you so much for being with us and giving us this valuable information for people to avoid or reduce the risk of getting hernia. Thank you so much for being with us today, Dr.
Thank you for having me. I appreciate it. Thank you.
Well, dear viewers, we still have more segments in our program after this short break.